Cassidy.
I'll begin with an opening statement, which I've been asked to give on behalf of Senator Moran. First, thank you, Mr. Chairman. Thanks to the witnesses for being here to discuss how to ensure veterans have access to the long-term care and support they need. As our veterans sacrificed for us, so we owe them to work to identify the gaps in care and find ways to improve the experience they receive when they work with VA to fulfill their long-term care needs. Access to quality long-term care is an important part of honoring our commitment to our veterans, an issue that affects the veteran, their families, the caregiver, and the community around them. I once got a call from an old high school girlfriend who just told me her father was in a nursing home, a veterans nursing home, and frankly, the abuse she felt that he was, frank abuse that she felt he was receiving. I have no doubt he was combative. I have no doubt he was combative. But that's one of the issues of taking care of people who are older. And was transferred to another nursing home, and it went really well. So I just use the anecdote because it's one thing to read the statement, but it's another thing to think of the individual patient. So it's an issue that affects the veteran, their families, the caregiver, and the community around them. I'm interested, how do we improve the coordination between the VA, the community provider, and other stakeholders so the veterans and their families don't have to struggle to access the support they earned? And I say that because she, going back to my high school girlfriend, the only way she got help was the fact that her high school boyfriend happened to be a U.S. Senator. Now, it shouldn't take a bad relationship for her in high school to finally pay off 45 years later. How much so the person who had a different life experience. So I say that because we can all recognize as the population of aging and disabled veterans increases, the VA will need to ensure high quality and adequate staffing for VA medical facilities, clinics, and community living centers, while also expanding its footprint in the community. We support the VA's efforts to honor veterans' preferences for when, where, and how they receive long-term care. The veteran and the veteran's family should have ultimate control over their health care decisions from the VA. We must also focus on caregiver support and recognize the vital role caregivers play in the well-being of a veteran. We must provide these caregivers with the necessary resources, training, and support to ensure they deliver the best care. Our hope is that your testimony will help us figure out how to do so, and I thank you for this. Let us honor our veterans' service and sacrifice by making sure they get the best care we can give them. With that, Mr. Chairman, I will then go to my questions. Okay, I gave you the example of a woman I know whose father had one experience in which he alleged abuse, and the other in which this same person, same family members, I guess proving that she's not entirely unreasonable, had an excellent experience. So I understand, now this is a veterans-run hospital, so I guess I have two sets of questions here. CMS and VA both provide oversight into these different settings of care. That's correct? To what degree do you communicate? If one has a problem, then the other can follow up on the same problem if their visit is intermittent.
So several of the things, and thank you for the question, Senator Cassidy. The aspect of care coordination is really one of the things that we have been looking at maximizing or increasing the effectiveness when we have our veterans that are either within VHA.
Now, when you say care coordination, I think of care coordination as a nursing plan, a care plan, but I think in the context of this question, you mean, okay, we've looked at this particular facilities, they're doing well, they're doing poorly. By the way, HHS, you're coming in after me, and state agency, you're coming after me again. You need to watch out for this, or you need to look for that.
So there are several levels when we look at the care that's being delivered in our community nursing homes. And I'll ask Dr. Hartruff if he'd like to expand on the aspects of how we look at the evaluation, the quality of care, and then how we communicate and partner with our CMS partners in order to make sure that...
I'm less concerned about the particulars of how you look at it, because I trust that you're looking at clinically significant things. What I'm more concerned about is that if there is a problem, that there is communication between agencies, and I think this is more of a yes or no, it occurs, as opposed to elucidating the process. Because obviously you want a warm handshake. Listen, we think that their restraint policy is being used too often and too indiscriminately. when you're going to be there in 2 months, will you be sure to look at their restraint policy? You see where I'm going with that, using a particular example as opposed to a process.
I'll ask Dr. Hartruff to expand, but I think that there are steps that we do have in place, but I'll ask Dr. Hartruff.
And that is to communicate with other agencies with
Yes.
jurisdiction.
Yes, sir. Many times whenever we do our site visits, which are every 45 days in contract nursing home, they do an on-site visit, and if they do find something at a level, they contact either the CMS directly to do a for cause concern, or they can talk with the ombudsman, and then also vice versa. Whenever we're doing any kind of oversight, we manage what CMS, we pull up the latest CMS survey just so that we're aware when our folks go in there what they were already aware of in their last survey, so that we.
So then that's wonderful. Let me ask you this. Just knowing that there's always a spectrum of quality,
Yes.
I suspect that there's some nursing homes that really you could do them twice yearly, even once yearly, and they're going to be pristine. And there's others that 45 days is probably not often enough, at least until they come under corrective action.
Yes, sir. Especially like with our one-star facilities, not only do they have the baseline 45-day visit to every veteran.
So
that's
1
in there-
star is worst quality,
Yes, sir.
and 4 star is best?
5-star.
Okay.
And so for the one stars, based on the quality level, there's the foundation for all is that every 45-day visit and then an annual assessment. With the one-star facilities, it even includes a waiver that has to be approved by the local facility director and the network director to justify why was that facility chosen over others. And usually it might be the only facility available or the best choice. So it has different levels of scrutiny based on the levels and findings. And then our staff can also do any time of ad hoc kind of site visits, and they have an oversight committee at each of the local VAs as well as what we do on a national level.
Okay. Is there ever, I mean, I presume so, but I'm just asking for the record, can a facility be so bad that it's busted and never again can a VA be allowed, a veteran be allowed to be kept there?
Yes. There has been times where we've actually go in and meet with each veteran to make arrangements for them to be placed go to other facilities if it gets to that point with a quality concern level.
Okay, great. Mr. Bloom, would you add anything?
Just to add that by law, we have to survey every certified nursing home roughly every 12 months, but that our teams also respond to complaints. And so as we get complaints, whether from the VA or any other entity, that's going to drive more action to ensure that we can ensure safety. So that our goal is to really shift resources to where we have the most challenge, and that's based upon strong partnership, that's based upon looking at complaint data, but the goal that we have is to ensure that complying with the law, that every nursing home gets surveyed roughly every year, but also that we can target resources where we see the lowest quality of care.
And so let me finish by asking this, just going back to the anecdote I gave, which was a little amusing, but it's a real-life anecdote. If somebody has a complaint to make, they feel as if their loved one is not being cared for correctly. When I go into nursing homes, and I occasionally go in and visit, and the ones I go into are uniformly wonderful, but I never see anything saying, if you have a complaint, call 1-800, file your complaint sort of thing, or if it's a VA patient, if your loved one is a veteran, et cetera. Is that required to be posted, or how would somebody know that? Because I'm just struck that, again, the woman who I knew, I don't think she knew how to make that complaint. And she's an RN and all this other stuff.
Patients served by CMS programs have the right to complain, and they can contact their state process. But there are procedures that we can follow up on to describe how patients can.
But how would she know of this? Would she just have to have the wherewithal to say it must be on the internet someplace?
Now, residents have to be notified of their rights to complain.
But I don't know that notification process. Now I do want to know process.
Okay, great.
Would she have to go to the nursing director and say, I would like to make a complaint to HHS?
That is one route that she can take.
That seems actually unlikely to occur to many people.
Yep. We'll get back to you, Senator, with a real clear description for how patients can follow their rights.
And is there a separate process for a veteran who is being covered by the VA to make a complaint?
Yes, sir. Again, during those every 45-day visits, an in-person social worker or nurse actually interviews the veteran in private and allows them and live.
Now, if the veteran has dementia, though, which many of these would, that would not be of help.
I'm sorry, sir?
If the veteran has dementia,
Yes, sir.
that would not be of help.
Yeah, and they make themselves available to caregivers if they're available or they know that they're coming, then they can reach out. If the caregiver were to be interested to visit with them, they can leave a note with the nurse to let them, give them a call whenever our people are there, and they can call them back.
So I guess my, not to beat it, but just to ask, how would the family member know that I can speak to the social worker of my loved one to make a complaint about, do you see what I'm saying?
Yes, sir.
How would she know that you were going to make your 45-day visit and she could be there in order to speak to the 45-day visit?
Yes, sir. Again, usually they know the date they'll be coming, but I think it is something we can improve.
Okay. Okay, well, thank you. I
If
yield.
I could just add, Senator, I think one of the other pieces that we try to make sure is a consistent process is when a veteran is placed, that social worker is actually reaching out up front, engaging with the family, the caregiver, so that they understand what the expectations are, so that 45-day visit that Dr. Hartruff explained is something that they should be made aware of up front. Now, the opportunity always exists for us to be able to reinforce when something is not going well, for families to be able to have the correct number, have the correct person to reach out to. So we can certainly take that and look at opportunities for improvement. Yes, sir.